Welcome, everyone, to this Settle In live session. My name is Chiamaka Gali, and I'm the Virtual Events Manager with Settle In. We are partnering with Switchboard for today's live event. Switchboard is a project implemented by the International Rescue Committee, and its mission is to support professionals and organizations who work with refugees. Switchboard is partnering with Settle In for this live event to help you understand emotional support services in the U.S. When commenting during this live session, please remember not to share any personal or confidential information as we are public facing. Overview. In today's session, we will discuss the signs that you might need emotional support, the different types of support, and your rights and responsibilities as a client. In part 2 next week, we will cover what to expect when finding emotional support. If you have questions during our session, please add those as a comment to this video or direct message us. What is mental health care in the US? Mental health can have different meanings depending on people's culture, family, religious beliefs, or previous experiences. In the US, mental health includes every aspect of emotional health and wellness, such as how people manage stress, interact with others, or feel in their minds and bodies. It's important to remember that mental health is important for overall health and could lead to stronger relationships, physical wellness, emotional resilience. Mental health concerns might include having trouble sleeping, feeling easily irritated, angry, or scared for no reason, and experiencing increased stress at work or at home. In the US, it's normal for people to discuss their mental health concerns and seek support. Signs you may need more support. It can be challenging to know when you need support, especially if you're focusing or prioritizing your basic needs and safety. When things are hard, you may notice changes in how you act, feel, and think. You may not feel like yourself or may notice your loved ones acting unlike their usual selves. Signs that you or a family member may need more support can vary, but common changes include difficulty with sleep, feeling tired or fatigued, feeling sad or crying often, finding yourself easily irritated or angry, losing interest in daily activities, isolating yourself from others, using more alcohol or drugs, having thoughts that you want to die, experiencing physical symptoms like aches in the head, body, or stomach, or thinking too much or feeling very worried. Every individual is different, and the changes we experience when life is difficult can vary. It can help to reflect on how your behavior, feelings, or thoughts change during hard times so you can recognize when you need more support. Signs may be different for adults compared to children or adolescents. Some common signs that your child might need more support include being afraid to separate from parents or caregivers, returning to younger age behaviors or habits, wetting the bed, talking less or having trouble connecting with others, feeling angry or experiencing outbursts, feeling very sad or frustrated, feeling like they want to hurt themselves or others. Types of support. Support can come from many different sources. Sometimes you might need someone to show you kindness and understanding. Other times you might need advice, financial help, or support in taking care of children and/or housework. If you're in the US and need additional help with emotional support, professional support options include counseling, support groups, and medication prescribed by a doctor. You might also find support through mentors, coaches, and self-help resources like books or videos. People in your life. One of the first places to look for support is among the people around you. A trusted friend or family member can be an outlet with whom to discuss difficult problems. Support could also mean finding someone who makes you laugh and feel good about yourself. Within the broader community, teachers and faith leaders can also provide guidance during difficult times. Mental health care at home. Some people practice mental health care at home and throughout the day, going for a walk outside to take a break from work stress, talking to a friend or family member about bothersome problems, getting a good night's sleep, or simply taking a deep breath. Each of these practices can improve mental health and emotional well-being. You can learn more about emotional wellness and coping with stress from our previous live events. We will share links to those in the chat, and you can also find the recordings on YouTube or on our Facebook page. Professional support. In the US, professional support is available when you need additional help. People in the US often seek support to manage stress and cope with difficult feelings. It's common for people in the US to seek professional support on a regular basis, unlike in other countries where such support is reserved only for those with severe symptoms. Professional support can include meeting with a counselor, attending a support group, or receiving medication from a doctor. It can be overwhelming to know where to start because there's so many forms of support. One option is to talk to your primary care doctor or search for services in your area using findtreatment.gov. Some examples of professional support include therapy or counseling, in which a trained professional meets with you to discuss specific feelings, thoughts, or experiences that are causing worry, stress, or sadness. Therapists and counselors support you to develop ways to understand and cope with these feelings. Therapy or counseling often occurs in an office setting or through remote telehealth platforms. Many professionals provide this kind of support, including psychologists, licensed clinical social workers, licensed family and marriage therapists, and licensed professional counselors. If you're interested in learning more about different types of professional support, make sure to attend our upcoming live event. Support groups, which often focus on specific concerns like sadness, trauma, stress, or worry. Support groups facilitate guidance and support from other people coping with similar problems. Some support groups include creative activities like art or cooking. You can find support groups for specific populations like mothers or teenagers. Support groups can also help you make new social connections in your community. Your primary care doctor or caseworker can help you find support groups in your area. Medication, which qualified professionals can recommend and prescribe to reduce anxiety, augment mood, improve sleep, clarify thinking and concentration, and support overall emotional well being. People receiving medications meet with their provider regularly to monitor progress. You can seek medication management services at your primary care clinic or with a psychiatrist. Emergency support, which is essential when you need urgent help. If you are having suicidal thoughts or have concerns for family member safety, there are national hotlines you can call for mental health emergencies. The 988 Lifeline, accessible by calling or texting 988, is free and available in all states, with translation services in more than 240 languages. Crisis hotlines are staffed by trained professionals who can send emergency responders to help, including mobile crisis teams and law enforcement. Hospitalization and inpatient treatment, which may be necessary when someone's state of mind could impact their safety or someone else's safety. In the US, hospitalization is uncommon except in cases of emergencies. Most people receive support through therapy or counseling, support groups, or medication. If someone receives support through hospitalization or inpatient treatment, the length of their stay in the hospital can vary from 3 days to a few months. If you ever feel that you or someone you know is in immediate danger due to their mental health, call 988 from anywhere in the US for immediate support in English and in other languages. Everyone goes through times when they need support from others. If you are concerned about your well being or the well being of a family member, we encourage you to use one of the resources above to find support options available to you in your community. It's okay to talk about how you feel and find emotional support if and when you need it. Patients' rights and responsibilities. When accessing emotional support, it is important to remember that you have both rights and responsibilities. As a patient, your rights when accessing medical care include the right to consent. In most cases, you have the right to agree or disagree with any treatment suggested to you. For example, if your provider suggests a medication, it is your right to voice your concerns and ask if there are alternative medications or methods to treat your issue. You have the final decision in your own healthcare. The right to access your medical information. You have the right to access your private medical information. No one else can access that information without your permission, including family members or providers other than your own. With a few exceptions, your information remains confidential until you give your permission to share it. The right to interpretation. You have the right to receive free help in your own language at any health center that accepts money from the government, like those receiving Medicaid funds. Tell the hospital or clinic staff that you need an interpreter when you make the appointment or arrive for emergency care. The right to respect of your own healthcare traditions and to choose a new doctor. The US healthcare system is large, and there are many medical practitioners from many different backgrounds. Some may not be familiar with your traditions or practices. If you feel like your provider is not respectful of who you are, where you come from, or your beliefs, You can choose a new provider who accepts your health insurance. Along with the rights you have as a patient in the US healthcare system, you also have patient responsibilities. Keeping appointments and arriving on time. Being on time ensures that healthcare staff can keep to their schedule and avoid impacting other patients' appointments. Providers might stop treating you if you are late or miss too many appointments. If you know you will not be able to go to your appointment, or if you are running late, call your provider's office as soon as possible. Honesty and openness. Your provider's care depends on how honest and open you are with them. The reason providers ask questions about your health history, especially during first visits, is to establish patterns, write down important information, and then offer diagnoses based on a combination of their expertise and the information you provide. Honesty with your provider ensures you get the best possible care. Following instructions. You are well within your rights to raise concerns with your provider about their diagnoses and instructions. But if and when you are comfortable with your provider's instructions, it is your responsibility to follow them. Not following instructions can delay the resolution of your health issues. What's next in part two? Today's session covered the different types of mental health care providers and treatments in the US. Next week in part two, we will talk about what to expect in a counseling session. We will post a link to that event invite in the comments so you don't forget to attend. For more information on patient rights and responsibilities, how to get interpretation, and other health-related topics, check out the Help Center. Thank you. Thank you for joining us for the Settle In Live event. We covered a lot of information. You can return to this recording after the event to review this information again. We also encourage you to follow the Settle In Facebook page for the latest information on adjusting to your new life in the United States.